Good afternoon. I'd like to call the special meeting of the Show City Council to order by roll call. See that all council members are present at this time. I'd like to welcome those of you who are here with us in the public today and appreciate your being in attendance. I'm sorry, I apologize for this meeting beginning late. I think in 8 years, this is the first one we've started late. So we're listening to the governor's press conference and just wanted to see if there's any new items that developed as a result of the press conference there. So it's still going on and we're still waiting to get insights and things from it. Would like to begin with invocation. I haven't had time to ask, is there a council member that would like to offer that? Councilmember Kelly, followed by the Pledge of Allegiance. Vice Mayor, would you lead us in that? Those who'd like to join with us in invocation, please stand.
Father in heaven, dear God, I ask that you bless this council with wisdom and our mayor and the community as we look at this situation that is before us right now. I ask for wisdom in the highest regard. In Jesus' name, I pray.
Amen. Please join me in a pledge. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Thank you. We have an item on the agenda here as a discussion concerning face mask. Just to give a little bit, I've asked our city attorney if he would like to just give us a little bit of a rundown of where we're at according to today. And then I'm going to share a new insight of what the governor's executive order has just changed some of the things and go over some of that the best that I can with such short notice. But, City Attorney, Mr. Brown.
Thank you, Mayor and Council. I put in front of you the governor's executive order from last Thursday. And I don't know if it'll show up well on the TV, but we'll try if someone can put it up there. The governor's executive order, I think there's a lot of misunderstanding about this executive order because in there he talked about how cities and towns could implement a face covering or mask policy. But in the executive order, if you'll read it, he indicated that businesses should and are required to follow certain guidelines and requirements that he had set forth previously in a previous executive order. And those are attached to the end of that executive order where it talks about the requirements for businesses. And it talks about a number of things, but one of the things that's I guess on people's mind is the face coverings. And it says that they should and are required to do face coverings when physical distancing is not feasible. And they should limit congregations to groups to no more than 10 persons when feasible. There's a number of other things that it talks about in there, including maintaining physical distancing of at least 6 feet and doing certain hygiene procedures. There's also, if you read a little bit further back, requirements for bars and restaurants. And in there's a provision that says if the local government has not mandated masks or cloth face coverings, cloth masks and frequent hand washing is required for all servers, host staff, employees that interact with customers. And the governor's order said that this would be enforced by local law enforcement and also regulatory agencies that have jurisdiction over the business, such as the Department of Health, Liquor License Control, and other things. So I think there's been a lot of misconception that if the city of Sholo didn't require face coverings, then they weren't required. That's not the case. They've been required in these businesses per the governor's order for quite some time, and including after Thursday, it was reinforced that they would be required. So that's, I think, one misconception. The other misconception is we got a lot of people that are calling saying that businesses can't require it. In a local business, they can set policies through their corporate headquarters or locally where they can require people that come in to face mask, cover up. I liken it back to the old days when you see those signs that says no shirt, no shoes, no service, right? A business can tell you what you can and can't do when they come into the business. So we get people complaining, they're requiring me to put on a face mask. You guys haven't required it. Well, that's their prerogative. That's what they can do if they want. So I just wanted to kind of reiterate that a little bit, that the governor's order does indicate that certain businesses are required to have those face masks if they can't social distance. It's been, in my opinion, I guess, experiences is that most businesses, you can't do that effectively. So if they're requiring them, then that's part of the governor's order. So any questions?
Sure.
Councilmember Leach.
So how, I guess, I don't know if you're going to answer this or the chief. So if it's an enforceable act, are we going around enforcing it, or waiting for phone calls, or with the health department? We're not walking in there. How are we enforcing it then, as far as restaurant?
Sure. So part of the enforcement has been working with the county, who has the county health department, and the governor has reiterated in his orders, and we follow suit, is that education is the big thing, to try to educate people first. We don't just want to go in and cite people, but we want to educate them that this is, per the governor's order, this is what's required. We hope that you would follow it. I think the governor's reiterated that today, that face masks are important if we're going to slow this thing down and get it to where we need to be. And so we try to do that first. I mean, if someone, I guess, Chief can tell me, but I don't think we've cited anybody yet, because we try to educate and work with them before we cite them.
Can I add a little bit more to that then? Okay, then I don't know how to say this, but have we started educating, and who's educating? Because I know probably most of the people up on this DS have got phone calls or texts or messages from restaurant owners. They're getting an email, but they need somebody to physically explain that to them, not send an email to them, because you can read it one way and I can read it another. The way you read it is your version of it. I could read it a different way. And I know it says it's mandatory if no social distancing, but then you get the question, say a restaurant, a server puts a mask on, serves the food, walks away and takes it off because he's out of the 6 foot. So that's the huge problem with that. And I get it. If they can't social distance, they're supposed to wear it, but touching it's supposed to be wrong. So I don't know how, because they call you and ask you, well, okay, my servers, my hostesses, once they get away from you, they can take it off. I don't know. I have no idea. So that, the clarification, should they have it on the whole time they're in the restaurant as servers?
Well, again, I guess it's open to interpretation, but I would read
Right.
that they do. But the education part is, a lot of it's been done through the health department from Navajo County. They've talked to a lot of people. Steve North from our the economic business development is sending out lots of emails, talking to people. We're trying to, the city managers called numerous managers of stores and talked to them. We're trying to get the word out. It's posted on our Facebook page. It's posted on our website. I think we're doing the best we can, but it's just, I know it's confusing because you hear, well, the city or town has to mandate the mask, when in reality it's already mandated for the governor's orders, a lot of it.
I think one of the things here, we have the governor's, executive order, and that's what most people just read, the 2 pages. Then they don't go in and look at the requirements for businesses. And it says all businesses, and it says what it says, requiring face coverings when physical distancing is not feasible. That's already in the order. You go into requirements for businesses, and it says businesses where service cannot be provided without all possible efforts shall be made to physically distance, shall implement and enforce a policy for the use of face coverings by employees and customers when feasible. These are the mandates that the governor put in place that's already in force, okay? For us to pass something on top of that, I don't think is something that we have to do. But yet it comes down to explaining it better to people, getting these requirements for businesses out. Like you say, it's the education process that still is lacking, and still the understanding of how businesses operate. But there's a lot of things. It gets right down to tables and tablecloths and chairs and booths, and all of that stuff is directed already from the way that they're supposed to operate. And then that needs to be enforced by the county health department And most enforcement and most compliance in this effort comes down to businesses and individuals either supporting it and complying to it or choosing not to. And it comes down to being responsible and realizing where we're at. Too.
Any other questions?
Any other questions or comments of council? We don't have a call to the public here, so I want people to understand that normally we put a call to the public for somebody to speak on a topic that's not on the agenda. But since this topic is on the agenda, we have always allowed people to speak concerning this. So if there's anyone in the audience who would like to share comments, one of the things that I will ask is to keep your comments, brief. Try not to have redundancy. If it's already been shared first, then to go forth. So just be thinking of some of your comments then, and at that point, you just need to come up and state your name and your address, and then we'll be able to listen to you, okay? But let me go through some of the things that have just happened that are already in force now that will be implemented soon, okay? The new executive order. And I apologize, I do not have any of the details or any of the questions. I just took snapshots off of the screen as the governor gave it. He goes, a new executive order, we are currently pausing the operation of bars, gyms, movie theaters, water parks, tubing. Effective today at 8 p.m. with the targeted reopening in 1 month. In order to reopen the establishments must attest and adhere to all public health regulations and post it for the public to see. Enforcement will be led by local public health officials and local authorities. So that is a new closure or pausing. I guess when you pause a gym or a bar, you have to close it for 30 days or the target reopening, okay? And so it's not necessarily going to be reopened in 30 days, but that's what his target is, okay? And there'll be an attempt that they have to follow those guidelines. The other one is limiting mass gatherings. Prohibit indoor and outdoor public events of 50 or more. The Department of Liquor License Control shall cease issuing special event licenses, applicable statewide. Cities and counties have the authority to approve larger events, but only if adequate safety precautions are implemented, including physical distancing measures. Okay. Guidance for pools. Public pools, municipal, hotels, motels prohibit groups larger than 10 from congregating together in or near the pool. Private pools, apartments, condos, multi-housing employees must post signage at all entrance requiring physical distancing and limiting groups larger than 10 from congregating near the pool. Certainty for Arizona schools, delaying the first day of school. The target date is now August 17th, 2020, and they'll continually reevaluating this target date of trying to keep Arizona kids safe and healthy. Work with the Superintendent Hoffman to continue encouraging virtual check-ins and encourage meal programs to continue for kids in need. And then staying connected with the ones we love most. There'll be grants for electronic devices and tablets at each long-term care facility and skilled nursing facilities. He's going to make available $10,000 per facility for them to purchase electronic devices so that those who are in those facilities may be able to put FaceTime and social media with family and loved ones. That was the updates that I had prior to coming into this meeting of some of the changes that are going place. I shared with us of where the numbers are, where they are currently going. We're headed in the wrong direction as a state as far as the spread of the virus, as far as what we have. And he wants us to reiterate that we are in a global pandemic. This is not an Arizona pandemic. This is not a Utah pandemic. It is not a United States pandemic, but it is a pandemic throughout the world. Okay. So with that, we'll allow a few questions or comments from the public who'd like to come up and share your thoughts. Sure. You can engage and ask a question.
Hi. My name is Carol Neville, and I'm at 360 South 15th Drive in Shoalo. And the question I have is, how are they going to, for the schools, how are they going to work that? When you say you got 50 people, then you got 10 people, then if they mandate that you have wear a mask, who says these masks stop the virus? I saw a thing on OSHA where they put they had the meter where it showed when they were breathing, they're normal. When they put the mask on, they put the breathe thing in, and it cut it down to half. So are you saying that the masks work and they're keeping that off from being sick?
I don't know that we are saying that. It may be said by some experts. It may be said by different people. I don't know that this council has made a statement concerning, nor are any of us qualified maybe to make a statement pertaining that.
Well, that's the problem I have is when you go to tell people they have to wear a mask, when they don't know that the mask keeps you from getting the virus.
Right.
That's the problem I have is the masks.
My biggest what I understand from the mask of the essential of helping wearing it, it provides no benefit necessarily from me contracting it. It may help prevent if I was diseased and didn't know I was diseased, that maybe it could possibly save a few droplets from going out. Now that's, but that's, a little, like I said, that's just some of the things that have been shared. I have read a lot of things that are out there. I've studied this as well, but that's just but as far as your question of the schools, that's going to be something that's totally, we got a school board member over here that's probably more qualified to answer that question than I am, but I don't know that they have an answer exactly of how that's going to work, especially with this new directive just changing.
Yeah, I guess to answer that question, our targeted date to start school was August 17th anyways. We had, back at the beginning of this year, we went from a 5-day school week to a 4-day school week, and we moved our start date from August 1st to August 17th. And so I'm assuming that, in the next 2 months, a lot's going to change. And so as far as how the school is going to respond to that, we've already been planning to start school on August 17th. And so we're going to continue to plan in that for that and see what changes here in the next month.
Is that with or without masks?
I don't think we can say definitively today whether we're going to require masks or not. So
that's the problem I have when no one can tell me that they work.
Mm-hmm.
I think for the school, there's too much time involved before school starts for us to say yes, we're going to require them or no, we're not. If the numbers come down significantly and looks like the curve or this wave, whatever we're experiencing, is flattened, then there's a chance that they won't be required. But if it's, if we're still in the same state that we're in today and numbers are continually rising, then that would be a different discussion.
And then my next point is with all the protesting, I have, no one's wearing masks. So, well, thank you.
Thank you.
Thank you.
Good afternoon. My name is Charlotte Lewis, and I have Hats Off Barbershop at 341 South White Mountain Road. And on one of the discussions that you guys had, it was on where to find out whether or not what the rules are for the businesses. If you look at, I have been getting, ever since this began, from the Disease Control Center. And so it has a complete list of what every business should be doing as far as, excuse me, I'm nervous, sterilizing, wearing masks, and taking care of the business for the customers, and what that, as far as that goes on the business end of it. I worked in the dental office for 20 years. I was also in charge of OSHA for 5 of those years. And I don't remember ever getting the flu or getting a cold from a patient because we always had to wear masks. So the whole point of the mask thing is yes, to protect you and you to protect me. My issue today basically is the mask situation and the sterilized thing because of me trying to conduct business in the barbershop. It has been hostile from the very beginning of the reopening. I've been called every name in the book. I've had it set up so that there's a letter on the door. There's information on the answer machine at the shop. People have banged on the door. They screamed and yelled. They've thrown their profanities. They call on the phone. They hang up. They call. They hang up. They call. They hang up, but they won't leave a message. But they are clear when I talk to them that they are not going to wear a mask. And it's their constitutional right. And I think that the politics needs to be left out of this because this is a national, a worldwide pandemic, and this is serious. The numbers are moving up steadily. I visited with my daughter from Tucson this weekend, and she said that the mayor has passed the mask mandate in Tucson, and every business will not do business with the customer unless they wear masks. If the customer comes in without a mask on, they are not given any business. They have to leave, come back with a mask, and then they can conduct business. They said that it's very comforting to know that they can go in, they feel comfortable because everybody is they're practicing the social distancing, they're practicing the masks, and they're also sterilizing. We have several businesses in town. This last week at work, the few customers that I had, there was an outcry for the businesses locally of not doing anything. One customer said he went into a restaurant, he watched a waitress walk up to a table, took their order, took the menus, walked back and put the same menu on that gentleman's, on his table. He said he freaked out and he said, "Are you not planning on sterilizing them on the menu?" And she said, "Well, I guess I can if you want me to." I think that everybody in business needs to be instructed on what they need to do, every employee, and they need to be extremely careful because it's not that difficult, obviously, to catch the COVID. So that's just my concern. I think that if they made it a mandatory thing, then everybody would calm down and they would say, okay, that's it. We have to wear a mask. That's the way it is. And then all the excitement would go away. Get the politics out of it and make this a medical situation for every business, because I'm not the only business that is experiencing these problems. There's several other businesses that are experiencing this that are trying to do everything they can. And so the barbershop is locked, but if you call and make an appointment, the door is open for you. But the outside of that doorknob, the inside of the doorknob, the inside of the barbershop is sterilized between every customer. I have a mask, the customer has a mask. Everything that's touched, that I touch or used, everything is sprayed in between. I wash my hands 3 or 4 times between every customer, because if I get COVID, how many people do I expose? So I just have an outcry because business has gone through the floor. I'm concerned that if it doesn't pick up and people don't change their attitude, I'm going to lose business. If I lose business, I'm 61. What am I going to do? Work at Walmart? So no pun to Walmart, but it's just the fact that we all have to work together in this situation. If we don't pull together, then how many more businesses are going to close? And is it worth it to our economy, to our local economy, for us all to close business? So thank you for letting me speak.
Thank you.
Thank you. Thanks.
Gordon Terracina, 861 North 33rd Avenue. Mayor, Council, I'm an avid user of our aquatic center. Go there 5 times a week. How does this new thing you just read a few minutes ago affect our pool? Could you?
Haven't had time to discuss it or
decipher that.
find out. I mean, I walked straight from there to here, so.
But I had to ask
I'm
that
sure
question.
I'm sure it's something that we're going to have to take in consideration given the directive by the governor. But our pool was one of the things that we took in place. I know that on other calls that I've had, the pool was one of the big things they wanted to open because Arizona is based upon pools. Where it's probably as high as any state in the nation as far as the number of pools that are out there. So I haven't had time. I'm sure there's question and answers about pools. He didn't mandate the closing of the pool, but I do feel that there's going to be stricter guidelines that need to be enforced to keep the pools open.
Thank you.
I'll go ahead and answer that too, Gordon. I know our city manager isn't here, but I know that he's doing all he can do to keep the pools open and everything else too. Good thing about pools is all the chlorine kind of helps keep that stuff down. So, but there's probably going to be mandates, like the mayor said, to maybe less people, less activities. There's at least, people can get in there and do their aerobics or lap swim to keep them in shape and stuff like that. But we won't know until the city manager gets with us and lets us know what some other stuff, and then we'll be talking about.
Anyone else?
Go back, Mayor.
Come on back.
Hi, my name's Rose Weaver. I live on East Owens in Sholo. It's really hard for me. I work with children with disabilities, and they're being refused healthcare because they can't wear a mask. So I just don't think that's fair. Don't you guys have accommodations that you can make for people that can't wear a mask?
I feel in the governor's executive order that he missed that point out, that there are definitely people who have medical conditions, whether it be asthma, whether it be autism, whether it be anything that putting a mask on a person changes their whole health and also changes, it's just not healthy for them, okay?
Right.
And so the governor's directive did not address that some of those people need to be exempt from areas of where they can have a mask, okay, or required of wearing a mask. And it's one of the things that we have addressed, and I believe we addressed it in our press release that we sent out, because it's been a topic that we've dealt with internally, and it's something that we're very much aware of. And if there's any action that is taken today, it's something that would definitely give direction that those people are able to still receive health care and still be able to go places and not have the requirement of it.
Okay, because they were just refused healthcare by Summit Healthcare.
Okay.
So I feel like that's unfair.
Right. And we're working on that. We've had several calls and discussions with Summit.
Okay. I just wanted to point that out. Thank you.
Welcome. Yes.
My name is Jamie Kaufman. I am on 540 South 11th Street. And I was recently denied health care because I have allergy injections. And they are very important to me because I have severe allergies, and I also have a severely deviated septum. And that's really hard because I also have asthma. So I just wanted to point that out, that I cannot wear a mask.
Right.
So,
And that's one of the things I think tagged on to the same question, that we will look at that, definitely. Okay.
I also recently had an incident. I passed out wearing a mask. I just don't think that's right.
Thank you very much.
Thank you.
Any other people like to share anything? I'll come back to you if you get second thoughts here, okay, on anything. So turn it back to council here for just some council discussion or some things here of what we want to do. Or there's also the possibility of taking an action, doing no action, or tabling an action. Those are the options that we have to do. Councilwoman Kakavas.
Mayor, as you know, I work at Summit in the administrative side of things, but I can tell you that our medical community is calling for assistance in leveling out this pandemic. Our hospital, today we have 17 positives and 8 pending. Pending means that they're in the hospital with symptoms, but their tests have not been returned as of yet. We're averaging about 10 admits through our emergency room a day. So many times in this rural area, we seem to feel like it doesn't touch us. And, but also in this rural area and this beautiful area that we live in, many times that there's people escaping from the metropolitan areas that feel like that they don't have to take the precautions that they would in the city because they're in a rural area. I'm not saying that we take people's civil liberties away from them. I don't agree with that at all. I'm just asking that, as a community, that we are cautious, that we are washing our hands regularly, that we are being cognizant of those that have impaired immune systems, and that we do what's right by them as well. I know that the medical community, again, is asking for us to assist with this and leveling out this pandemic, because our little community hospital is really bursting at the seams. And our healthcare providers, we geared up for this pandemic back in March. We didn't get patients in. They stopped elective surgeries for a period of time, which had a negative effect on your community hospital as well. But our healthcare providers have been dealing with this for a long time now, and they're tired and they're worn out. They get yelled at, they get screamed at, they are cursed at, and whatever we do, if we take no action at all, that's fine with me, because to me the governor has put things in place that are appropriate at this time. But as a community, we need to come together and support each other and realize that this thing isn't going away anytime soon. We all have a part in making it better. We all need to follow the directions of the CDC. We all need to do our part to make our community healthy.
Thank you. I just want to add on that education thing, that people need to realize the only way we're getting rid of COVID-19 is if our Heavenly Father wants it to go away. I'm sure He isn't the one that put it here either, okay? But it's here. It's just like the flu. How long has the flu or the common cold been with us? 10, 20, 30, 40, 50, 80 years, 100 years? Do we have a vaccine for it? Do we have anything that's eliminated it? Absolutely not. Do we have a medication that helps us avoid it or helps us? Yes. Do we also have, by taking those shots, can it cause a different reaction of something else to surface? 5% of the cases it does. Okay? So we need to understand that COVID-19 is not going away anytime soon, that it's here. And we need to learn how to coexist with it. And we need to learn how to take safety precautions, the same that you would if you were jumping into a river that is rushing down the hill. Do you want to jump or do you not? Or if you have to jump, can I take a floating device with me? That's a choice you have to make, okay? But I think we have to understand, like you said, it's here. And so what do we do to help us to be more effective, to be a good neighbor, to be friendly? How do we treat each other? If there was something to mandate, I would like to mandate a penalty if somebody mocks or makes fun of somebody, whether they are or are not wearing a mask, okay? We need to treat people civil. We need to be kind. We need to be considerate. People have their choice and they have their accountability, and we need to allow them the freedom of choice, okay, on that. Councilmember Hatch.
Yes. Thank you, Mayor. I'd just like to speak a few moments about my personal experience with COVID-19 and the prevention of catching it or passing it on. I've gotten over the self-consciousness of wearing a mask. I understand the value of that. COVID-19 is not a beautiful way to die. It's a very, very painful, long, drawn-out, suffering, terrible thing for your loved ones to watch. I have a young great-granddaughter that has a disease that will take her probably in her mid-teens, and luckily we'll see her later in her life. But we have to be careful with those kinds of people that are fragile. I'm carrying a little bit of a fragility myself. I'm 76 years old. I just went through a four-way bypass. I have diabetes. All three of those are high hit lists. That helped me get over wearing that mask. I do it because I'm a little selfish. I want some more time that the good Lord's granted me on earth. but I don't want to be guilty of passing on anything that I happen to bring home. So you'll catch me wearing my mask more often than not, here and in public. And I'd implore people to search themselves. We've got a real brouhaha going on in my family with a son that is definitely against it. It's a violation of his civil rights in his mind, and I can't argue with that. I feel much the same way. If I look back at his age, I would be probably saying the same thing. But I'm a little older now, and I've gone through a little bit more of life's experiences. I've got older relatives that are fragile and will be leaving us soon, not because of COVID-19, but that would certainly speed it up. But I would just have everybody search their hearts about the young ones in their family and how we might protect their health and protect our own health. Like they said, this is more for the prevention of my passing along something that's infectious, and I'll wear it gladly. I don't necessarily like to wear masks. I've always been against Halloween just for that one reason. But I think we need to soften up a little bit on the rhetoric and look at the positive aspect of it. Sooner or later, someone's going to invent or develop inoculation for this contagion, and hopefully it'll go worldwide, and we'll see that COVID-19 dissipates as quickly as it came upon us. If you look back when we first discovered it and count the number of deaths that have happened, there have been a few epidemics that are flu epidemics that have caused these kinds of deaths, but not since I've been a part of it. I had a very, very close friend when I was growing up, about 5 years old, that we were all quarantined because of poliomyelitis. They drained the pools. They caused the little kids to stay at home with their parents and out of public as much as they could. And I got to go down and visit with him before he passed away, and he was in an iron lung in his living room at his parents' house. I'll never forget that. It's something that my parents, through their knowledge and through their wisdom, protected me from that kind of thing. And I think that maybe we need to look at the generations coming, our obligation to see that their health is intact when that vaccine is in fact invented. Thank you.
Thank you. Appreciate that. The comments, council?
Yeah.
Vice Mayor?
I just want to share, I've been going around town and going to different restaurants and stores and everything, and I've been wearing my mask in, and as soon as I come out, I take it off. But everything this started, I've been having to work up at the Navajo before, just about 2 weeks before this epidemic came across. And first thing I want to do is I want to apologize. I just came from work, so I got a hat on. My hair's dirty. I'm sorry, but I'm going to wear my hat. So, but after working and seeing all this stuff that's been going on with the mask and everything, and what's going on the Navajo Nation and what's going on with the White Mountain Apache Reservation, if you walk through town or see anybody wearing a mask right now, 90% of the people I see is wearing masks is the Native Americans. They've been wearing it constantly. Every time I go into a store, I always see them wearing it. Where I don't see people wearing is the people that just thinks that everything's okay. I'm one of those. I think everything is going to be all right, but I am just wearing a mask to help protect people in case I'm sick that I have no idea that I caught it. And so we try to do that with everything. We got the farmer's market going on. I apologize to the lady. I can't apologize. I didn't cuss and swear at you, but nobody should take that kind of crap from anybody when you're trying to do something like that. People at the farmer's market, same scenario. We have out there signs and everything else, and everybody is complaining about having to wear a mask. It's what it's came down to. We as Frontier Communications, every time I walk into my building, I have to put a mask on until I sit down at my desk and I can take my mask off. 90% of the time I work out in the field, so I don't have anybody around me. So I just keep a mask in the truck, and whenever somebody comes by, I have to put it on. But corporations has got all the rights to tell us what to do and how to do because I'm an employee with them for another 8 or 9 months. And then I can change. But we as a city, I think, is just trying to protect and make sure everything's okay. We're between a rock and a hard spot. Here in Show Low, right now, we have the Navajo Nation north of us, White Mountain Apache tribe on the south, and we have the biggest influx of this virus right now, according to the numbers, is Phoenix and Tucson. And everybody wants to come up here for the summertime to get cooled off. We have no way to block off our streets, our roads, keep people out, and it's the hardest thing for us to do. If this virus was in the springtime or the fall, it might be a different situation for us up here because we wouldn't have the influx of people coming in and out. But right now, with the influx of people coming in and out, it's just so much for us to take the safety precaution of that. But we get ripped for it. We get ripped because I'm from Phoenix and I don't wear it down there and I'm not going to wear it up here. But you guys can see where the numbers have changed. The numbers changed and it started growing a lot up here. So it's a hard thing to do. And at least with some of the people's calling in and some of the stuff that we're getting, emails and stuff like that, it's about a 50-50 of who's for and who's against it. So it's dang if you do and dang if you don't. But, you know, we're trying to, like the mayor said, this is a epidemic that's going to be around for a long time. And we're just trying to protect everybody the best that we can.
Thank you. If I were to ask each one of you that, you know, whether you do or you don't have a mask on today, if you'd be comfortable with something that would require you to wear that mask for the next 5 years, how willing would you be to say that's fine with me? Okay. But that's what you have to look at sometimes. The other thing that I look at it, if sometimes it's beyond, I know we have a pandemic, I know we have a serious issue here, but if it continued for a year or 6 months, and if I were to borrow Vice Mayor's hat and I were to put my mask on and I were to put some sunglasses on, I will guarantee you that probably 95% of you people would not recognize me. If I spoke, you may, okay? But I can change my identity with a mask, with sunglasses, and with a hat. So when I start requiring something, or if I would require something that would change your identity completely for an uncertain amount of time, that's where I start saying we're infringing a little bit too far upon a person to choose whether or not they want to or not wear a mask at a certain time. I would hope that each one of us would take the responsibility to exercise caution, to exercise discretion, and to do what we can to help each other, okay? And what I mean by that, the number one directive that is health prevention is to stay home, to not socialize, to be there. And we know how well we like or don't like that, but that's where you're safest. Number two is social distancing. Can you social distance between here and the car? Are we social distancing here? Yes, we are. Can I maintain social distancing at most types of businesses that I'm associating with? Yes. But I may encounter a situation where I cannot. Am I prepared at that point to put a mask on so I can continue doing what I was to help protect others? That's what we have to say. Are we willing to think of others and not ourselves, okay, in that situation? And so that's where I think as we educate ourselves and as we learn about this, there are certain things that we need to realize that it's a little bit more about being mandated. It's about being responsible and being citizens that care for one another, okay? In whatever way you choose to do that. Councilmember Kelly.
Did you actually think you'd get by without?
Absolutely not.
You didn't think that. You're smart.
Well, I kept asking other people if they had questions. Eventually, you'd say something.
I kind of tipped my hand, if you listened at all, as I tried to lead us in prayer. If each one of us will sincerely pray for wisdom, the scripture says we ask for wisdom, we'll be given. Wisdom. That's quite a promise. Another part of scripture that comes to my mind is we don't offend one another just because we can or have a right to. So I might wear a mask if I totally did not believe it would help at all, because I knew it was going to offend the mayor. Think about that. Pray for wisdom. Ask the Lord to lead us, guide us, and help us through this. We cannot possibly win this topic as a council or as a mayor. It's impossible. There are so many different positions. It's not just yes mask, no mask. The one lady mentioned she has a health problem. A mask will really hurt her. We know that's true of some people. We know that. What would make any sense for anybody to advocate mask required? We don't care about that person. What's that say about you if that's what you're saying in your heart? I'm asking you to reevaluate your heart. There are those that have told me they wanted the mayor to dictate regulation and come down hard on violators. You know what? I'm glad we live in a country that does not allow our mayor, not picking on you, sir, to be king. It's not allowed. What are we saying? We don't want that. Oh, we want it if we hope he would dictate something we want to happen. But the minute he dictates something we don't like, then what are you doing? So for our mayor, you talk about a no-win situation. Oh, wow. Our country was founded and based on the fact that the mayor can't make law. Our governor, he's got certain rights under certain circumstances. We're glad for that. But he can't make law either. And I'm hoping, I am praying that we will all seek wisdom and go about our daily life, not just with the mask issue, but any issue that comes up. Let's not be about offending our brother and sister on planet Earth just because we think we have the right to do it. I believe if we look to our Lord, Savior Jesus Christ for our direction, we'll come into far more harmony than some people even think is possible. Thank you.
Thank you, Councilmember Kelly. You know, it's interesting as you just sat and observe. I've done my 16 years here with the city of Shuttle. I could have been done when I was appointed to serve as county supervisor. And everyone on this council knows why I'm still here today. This has been the single most topic of more discussion and more stuff sent to the city of Sholo, more personal stuff sent to me personally on any other topic, bar none, that I've dealt with in the 16 years. And what I'm special about today is we have, I would say, a room that's somewhat divided in opinions. We have a community that's somewhat divided in process. But we don't feel that hostility at all in here today. At least I don't sense it. But I sense a unity of a community of how do we work together and how do we solve a problem together and how do we come forward together going forth. Okay? And so that's my recommendation, is that we go forward making our own selves responsible, making a city responsible to educate, helping businesses understand what has already been mandated of them from the governor, helping citizens respect one another and each other's choice. That's what I feel is where we should go, because as Councilmember Kelly shared, there's not a win in a decision of this council. This council is together today kind of by my choice, or my asking if they would come together. When we declared when an emergency was declared by the city of Shoalo, after the executive order, we declared an executive, and that gave the right of the mayor to make decisions for the city and not to have a decision of the council. There was people who said, yeah, when are you going to give back that control? Why did you take control? Why did you do this? The minute that we came from the stay-at-home order, I called and relinquished that executive order that we had as a city and put it back into the control of the council. So when we sat and we talked the other day with other leaders of other community leaders about the situation, my position representing the council at that time was that we educate and that we learn and that we come forward. And then those other cities have made their choices and their decisions. So for us to make a choice and decision, it needed to be from the body of this council. And so I wanted the council members to be able to share their opinions and their feelings of what they have, because we have worked together as a council, and we've worked together for the betterment of our community. Okay. I normally don't read things. I normally don't have anything that I'm going to say written out beforehand. But just in my closing statements before I'll turn it back to anybody who would like to say anything else, I do a little Mayor's Corner each month, and I had to get the one ready for a month from now. It's kind of hard to think what's happening, but I kind of look back at the blessing we have right now of that we aren't having a parade with the new mandate of 50 people, the disruption that could have caused people's lives and stuff. But it says, dear citizens, if I were to put a bumper sticker on my car that read, I do what I want, how would most people who saw this react or think about me? Is not that exactly the sticker we all have? When we came in this world, we brought with us the God-given gift and privilege to make decisions, and this is our agency. Each person must have the right to choose. Our Constitution is designed to protect this right, and it gives us the freedom of choice. So the sticker, I do what I want, is correct if you live in the USA. Let me share some ideas from David R. Stone, and he quotes, what an insidious thing is this culture amidst which we live. It permeates our environment, and we think we are being reasonable and logical when all too often we have been molded by the ethos or the culture of our place and time. He says, because my wife and I had the opportunity to live in 10 different countries, we've seen the effect of culture on behavior. Customs which are perfectly acceptable in one culture are viewed as unacceptable in another. Language which is polite in some places is viewed as abhorrent in others. People in every culture move within a cocoon of self-satisfied self-deception, fully convinced that the way they see things is the way things really are. Our culture tends to determine what foods we like, how we dress, what constitutes polite behavior, what sports we should follow, what our taste in music should be, the importance of education, and our attitudes toward honesty. It also influences men as to the importance of recreation or religion, influences women about the priority of career or childbearing, and has a powerful effect on how we approach procreation and moral issues. All too often, we are like little puppets on a string as our culture determines what is cool. Close quote. The one thing about the sticker, we must take personal responsibility for the results of exercising our agency of choice. There must be accountability for our actions, and we must be willing to deal with the consequences. We must realize that two individuals can do the same thing, but the consequences can be as opposite as night and day. May we always be grateful for the agency to make a choice. And may we realize there is a culture that wants to divide us so they can conquer us. We, the people, are stronger as we stand united. May we continue to hope and pray that God will bless us. Thank you. And so I challenge each one of us to be better, to be more kind, to help others understand where we're at today. And I just hope that and pray that you will support any decision that this council makes. You have your right to not agree with the council this decision makes, but we are trying to think of the people and do what we can. And so at this point, I'll turn it back to council if there's anybody who would like to make a motion or take no action at this time.
Mayor?
Any other comments?
The one option, council, that I just wanted to, as we were thinking about this today, is that you obviously can take no action and just leave the governor's orders where they are. But one thing we could do is do our own emergency proclamation to say we're going to follow those orders. Maybe that gives it the emphasis that we need here in town to say we want businesses to follow this. It's already the governor's order, but it gives it that extra emphasis and maybe a little better education. So we could do that and direct the mayor to do a proclamation such as that. So you can do nothing. You can do an emergency proclamation that says follow the governor's orders, or you can do an emergency proclamation that goes beyond that. It's up.
Thank you.
So, Morgan, so are you saying that if we do nothing, it still follows governor's orders, period, right? So the only thing that I like the idea of the mayor stating that, government doesn't need to mandate people in my world to wear a mask. It's your right to wear one or not wear one. I agree with everybody in here. I mean, everybody said the exact same thing that we all agree upon. So what I don't understand, if we do nothing, we still have to go by the governor's orders anyway, right?
We're getting a lot of people saying, but you guys haven't ordered anything, so we don't have to wear masks. And that's not the case, because the governor's order says you do need to wear the mask.
Okay, so just so I'm understanding, so if we act on what the governor said, that doesn't mean we're mandating people in the city limits to wear masks, right?
No, it's just to
follow the restaurants.
Follow the governor's orders, like when you're in restaurants or the stores or different places where it's already mandated by the governor.
And bad on me trying to educate myself through this, because I'm still not understanding it completely because of the social distancing, but I'm glad. I want no action as far as mandating masks. That's my belief right now. I think it's your right. If you feel you want to wear one, I definitely don't talk bad about anybody wearing a mask. That's your right. I will never, ever do that. And I'd probably get a little upset if I seen that happening, but I just don't want to get confused on if we do nothing, we still have to follow the governor's order. So that's what I just wanted that clarified as far as doing nothing, because to me, we still follow it whether we do nothing.
It's just a proclamation that we have made a decision, and we've made a decision to follow the governor's orders that are there. And in some places, he has mandated that certain businesses, if they cannot maintain social distancing, that they shall, require people to wear a mask. Okay. So that's just following the governor's orders. It's not dictating beyond that.
Okay. So I get that part. Now, if he comes back, we didn't finish watching it, I don't think, with questions and answers just now. But so if he comes back and makes it mandatory for the state to wear a mask, does that come back to us, or do we have to go back to this again and approve governors? I mean, where do we go then? Because I personally was really expecting that. I'm glad he didn't. I really am. But I was waiting for it in there for him to do that. So let's say he has another press conference next week, and do we have to come back in here, and
no?
How's that going to work?
So usually when the governor does that, if he mandates it statewide, it's the governor's order is followed, and the city and towns can't change that. In this last order, he and that's where I think we got a lot of confusion, because he said, well, here's my orders, but if the cities and towns want to take it a little bit beyond that, they can. So everybody thought, well, if the city and town has to do it. Well, no, he already issued the order. He was just saying, if you want to go beyond that, you can't in the city and town. So if he goes and says there's a state order, statewide, usually it says cities and towns cannot change this orders.
Education's very important right now.
I think it's what's been difficult is the governor has mandated from day one what we shall and what shall not do as far as with his executive orders, and he has taken away local control. And then he gave back local control on this last thing after he had already mandated what the requirements of the mask will be. But then he says, if you want to go further, it's up to you to go further. And that could be like California. The minute you leave your house, you have to put a mask on. You have to have a mask at all times. Right now, based on the governor's orders, nor can we rescind those orders. We have to be lawful citizens to that right now. But right now, if we could not maintain physical distancing, or if you have a particular business that says that they're going to require you to wear a mask, then that's their prerogative still. And so we just need to understand that those stores have that right. We're not dictating to a store that they have to, other than the governor has dictated that there are certain stores, certain businesses, if they are in the food business, that they shall do this if they are not able to have social distancing. And it is difficult because there's a lot of things and a lot of stuff there. It gets down to wash your hands with soap for 20 seconds and 60% down alcohol. And it's just the safety things there. But if you're in that food business, you have all sorts of regulations. How long should you allow this food to stay out? How long you got to wrap it? Those are just adding to the measures that they need to be following. Okay.
Morgan, I am grateful that you just brought all that stuff up, because I agree with everybody here. There's been so many different directions, and we just need to have at least one direction so we know which way to follow. So I totally agree with you. Thank you.
Councilmember Clark.
Morgan, I just want to thank you for the work that you've already put into this. I know it's a lot of research and a lot of time. What mechanisms do we have? It sounds like we want an educational component to come forward from this. How are we going to do that? Is it going to be city staff who's going to do that? Are we going to try to work with the chamber? I know that in our last city council meeting, we talked with the chamber about, they man our tourist information center. Is there an opportunity there to kind of partner with them and figure out a way that we can educate our businesses here locally as to what's really required of them from the governor's office? Because it doesn't seem like a lot of the education has come from the state level. They're kind of leaving that up to the local level. So,
Yeah, I think, from talking with city staff, we're really trying to step up our game, I guess, and getting the word out.
Mm-hmm.
Maybe we're a little slow at first, but we're trying our best to get the word out. So working with the chamber, we have also Steve North, our economic development director, doing stuff. We're trying to post things on social media and our website. Maybe like one of you mentioned, maybe we just need to go and tell people, here's the, step by step, the things you need to do. We were hoping, and I think it's happening at the county level, the public health is going out, talking to restaurants, talking to stores, and talking to bars. Of course, now the bars are closed for 30 days, but we're just going to try to continue to do that and do that. Of course, when you guys get questions, if you want to direct them to us, that's fine. Or if you know the answer, you can do it. But it's sometimes it's just hard to get the word out.
I'd recommend, I don't know if we have I think we have the resources, maybe work with Mel West and his team and develop like a short 30-second minute of exactly what the order says. And we could kind of, I know I've been in a meeting with the public health director where he has email addresses for all the businesses in Navajo County, and we could shoot that out to them, put it on our website saying this is exactly what's required of us. And if you're a business that can't, I'm looking at part of it. If you're a business where you can't provide social distancing, you have to mandate that your employees and masks, or your employees and patrons have masks. And so I think that would be a worthwhile endeavor to get that out as quickly and as fast as possible.
That's a great idea.
And I agree with that as well. I don't want to rely on the county to do that for us at all. I think I'd volunteer to go. I'm not the most educated person on it yet because I'm still trying to figure out everything, but I'm sure everybody is. But I think we can all do our part. And I talked to the mayor the other day. I'd be more than happy to go out and try to answer all. It's easier than emails and telephone, that's for sure, because we get enough of those and when we don't understand. But I love that idea of educating on the website better than the TV station, because I think a lot of people would go to that and watch a short program.
And one of the things too, Mayor, if you don't mind, if I take another second, is it seems like we want to educate our businesses and we want compliance from the community. And I agree wholeheartedly. And I agree with everything that's been said here from the council, and I appreciate what they say. And I think that the education component, I want it to come from a standpoint where it's in a situation that's a little bit, it's not a heightened, it's people's tempers aren't flaring, like Councilman Hatch talked about, how some of his family members have, this is a heated debate, whether or not it's violating their constitutional rights and stuff like that. And so I don't want to see us as a council pass something that requires enforcement from our law enforcement officers, who then are sent to a volatile situation and they have to try to educate at that point and try not to escalate it with, and potential use of force and all of those kind of issues. I see where law enforcement's being treated by the media at this point. I don't want to saddle them with something greater that's going to be a hot button item that they're going to be then thrust in, and they're going to have to, we're going to potentially have problems with that. So that's where I'm leaning. I think that education could be done in a different manner, as opposed to having our law enforcement officers be put in a volatile situation that's highly charged and very political. So that's where I'm leaning.
And I have to agree with you. Even the public, I mean, we can't stop just as businesses or anything else. We got to get it out to the public so they understand what's going on too. But they might walk up to a business and see that they have to wear a mask. And so instead of them just getting upset or frustrated about everything else, public needs to be understood what's going on with this proclamation from the governor too.
Let me just, what we're doing right now, currently, we're working on a campaign a little bit towards education. You'll see some of our signs coming in or coming out, our informational signs. They're saying mask up. It doesn't mean that we're requiring that. It just means we're educating people of the awareness of it. It also, we have made some flyers that we can give to the businesses that we can have it. It's interesting that Sedona took the measure that they have helped the businesses understand it. So as they understand and they say that they follow these guidelines of the governor, they put a little sticker on their businesses that we're safe, we're clean, we're healthy, or whatever. It just knows that they're working towards it. So people who go there know that they're doing their part to make everything well. We have certain businesses in our community that are following this guideline, that people feel safe, they feel protected, they want to refrequent. And one of the biggest concerns that I've heard from people is they just want to feel safe. I really feel the lady here that shared with us today with her haircutting, she's doing everything she can to be safe and to feel safe and to make her customers feel safe. Those are choices and decisions that she is doing, and I think that's to be represented and to be honored, not to be criticized or put down. But she is also saying she wants to play on the same even playing field for customers and things that in that type of business, everybody should have the same, abide by the same guidelines to open up and to do business. And I get that as well. Yeah. Yes. Who had a hand? Jean, Connie?
I think the businesses are reaching out to us to gain that support from us. They have heard the governor's executive order, but when he gave it to local control a little bit, we still have to follow that, as you said. There's not really much we can do beneath that. And so the confusion for our businesses is we really just need to kind of support them, educate them. We do enforce the governor's executive order. We don't have a choice. And so it makes an even playing field for those businesses. And I think if they know that everybody's playing on that same field, then they're a little bit more comfortable. They want to be safe in their businesses.
Councilmember Kelly.
So again, for understanding's sake, as the governor made his statement of the mayors having the right to make certain restrictions or guidelines, it should not be interpreted that any mayor could reduce his requirements,
Correct.
but could enhance them, make them stronger, or whatever like that.
Correct.
So if we were to take an action today, I think I would be in favor of saying we want everybody to understand the governor's orders are in place. And any alteration we would make on them might be to strongly encourage a recognition for the exemption of people who are physically harmed by the act of wearing a mask, if it's not in his order.
It's it is kind of in his order, Gene, but it's very complicated because you can't look at the order and see it. But if you go to the website, it says they follow CDC guidelines, and in CDC guidelines, certain disabilities under the ADA are protected. So it takes a lot to get there. And I think you're right. If we do the proclamation route, if that's where you choose to go, it would be helpful to say certain people with these conditions don't need to wear them.
With an emphasis on the CDC.
I'd probably leave the CDC out of it. Just say that, those with an underlying medical condition or those that are in these certain situations. And we can work with the language. If really what you're saying today is, if we do that, is to give the mayor the opportunity to come up with something that says that.
Thank you.
Right now,
Yeah, I think we have to understand that when the mayor made his direction to the mayor, the mayors or people that do that, he's referring that most everybody was still under executive order, and the mayors had the privilege to make that action. At this time, I could have gone and ordered a new executive order and gone forward, but I had gone back to council, and so I think that's kind of a little difference there of understanding that. So we go forward. You're going to share anything else, Mr.?
I hate when government creates redundancy, and I don't want to. I don't feel like we need to pass something to say that we're going to follow something that's already been enacted. So I don't like bureaucracy and creating more just to do something. So my personal opinion is I feel like the governor's has already mandated the requirements for businesses, and that we just need to do a better job of educating our businesses and helping them get the word out and do that. And so that's my line of thought there.
Yeah, welcome back here. You have
I totally agree. That's why I wanted it clarified, because if we do nothing, we're still going with the governor's order. So I agree. Why do anything? It's already there. If we were thinking about implementing masks, which kind of why we were here, but if we do nothing, it just stays with what he said anyway. So nothing is good.
There's nothing, but there's also, as the case that we do have some people in our community that have challenges of getting health care that qualify for it, that we could, with something could help them a little bit easier too.
Add that to ours.
Right. A proclamation. Yes.
I just wanted to say that I researched Google and whatnot, looking for information and stuff constantly. The other day, Thursday, when Pine Top Lakeside came down with the mandate for face masks, that underneath that there were comments, and there were comments that everybody don't do any business in Pine Top Lakeside, go to Sholo. So I'm hearing exactly what you're all saying. I think it's just confusing for everybody. And if everybody just kind of waves on the same thing and pulls together and everybody works together, that it will help, hopefully, the public, because the public is the biggest thing, to try to get them to understand, to be kind and nice and do what they can to protect all of us. I understand that Pioneer Title Company in Pine Top was closed. There was 3 people that came down with COVID there. There's a few businesses up there that were closed because of it. But I just wanted to add that because of the negative. There was an article that came out in the newspaper as well saying, negative about the mask and stuff. And so if we keep getting the negative, then it just helps set the tone for those that don't want to wear the masks anyway. So I just wanted to add that so that you know kind of what's being said. Okay.
Thank you. And I think we can do a better job of updates. I had a scheduled update today with the CEO of the hospital and also with the county health director, but it didn't make sense to do a 2:00 meeting when the governor was going to change things at 3:00 possibly. So we'll do that at 4:00 tomorrow. No, but we'll do that on probably Wednesday, just getting more updates from the county, more updates, and we can be vigilant about doing more of those updates as well.
My name is Don Jackson. I had the opportunity of going to the farmer's market for the first time, actually being a vendor at the farmer's market. great experience. One thing that I'm fascinated with, I watch people a lot, and I think the masks are a compassionate thing. And if I understood correctly, that's what some of them were saying. For me, I worry that when we're handling our masks on and off, on and off, and on and off, they're in our hands. So any of those germs that we've caught either inhaling or exhaling, they're on our hands now. And so as part of the education that businesses may need is how do you protect outside of washing your hands all the time? You have to leave them on. You can't touch them. But if you adjust them down or adjust them up, all those germs are now on your hands. And you go into any business, whether they require to wear a mask or not, there's no sanitation stations. There's nothing now for all of those germs to be killed on your hands. So that's something that fascinates me. Whether you choose to wear a mask or not wear a mask, all those germs are on your hands when you handle that mask.
It's been proven that they also can catch it through hand to mouth and also through your eye duct. And so our eyes aren't being, protected either. They're open. So there isn't anything better than just the good old basic wash your hands, sing happy birthday for 20 seconds, right? And do that often. So those are the things too we have. Anyone else? And then
My name is Jody Simmer. I'm at 1441 West Oliver in Show Low. I wanted to voice my opposition in being mandated to wear masks. I don't think that they're effective. I think that between the CDC and the WHO and Dr. Birx and Fauci and all these experts, I think there's been so much conflicting information going back and forth. Don't wear a mask, wear a mask. Asymptomatic transmission is very high. And then the next thing is asymptomatic actually isn't that high. So I think that the effectiveness and the validity of wearing a mask has really been reduced by people. I think that for me, I don't see how it's effective when I see people where they have said that any type of face covering is going to work. It can be a surgical mask, and N95, it can be a bandana, it can be a scarf, it can be your shirt pulled up. Those are not effective. I've seen when I go into stores, people wear their mask where their mouth is showing or their nose is showing. Those are not effective. They're not protecting anybody. I have someone who had a company issued mask to wear at work, and it literally is a rectangle of t-shirt material with 2 slits down the side to put over your ears. That's not protecting anybody. I'm not saying that COVID is not real. I know it's very serious. I know people personally who have tested positive. I know people personally who have lost their lives from it. I'm not saying that it's not a real thing or an issue. But I did want to express my appreciation for those of you who are wanting us to be able to keep our accountability. I don't wear a mask, and no, my heart doesn't tell me I'm not doing it because I don't care about other people. My heart is telling me that I have the choice, and I go to my Heavenly Father every day and ask for guidance and direction on what the best thing is for me and my family. And I like knowing that I have that accountability and I can be a responsible citizen and I can do the things that I feel are best for me and my family. And I do take precautions. I don't take my kids out shopping with me now. I keep them home as much as possible. I go shopping as little as possible. But I don't see how they're effective. And I can't even tell you how many people I see jogging and walking the park every day with masks and gloves on. That's not helping anybody because now that they're using those gloves for everything, and it's just spreading germs. So I just wanted to voice my appreciation for those of you who are wanting to make sure that we get to keep our accountability and our agency to be able to choose for ourselves. Thank you.
thank you. Yes.
My name's Becky Kaufman. I live at 540 South 11th Street here in Show Low. This has been really trying for me as a parent with the compromised individual. While I understand that there are some that are scared some that don't want their freedoms taken away. I'm here to advocate for those that can't. I'm here to advocate for those individuals who have many different disorders that prevent them from wearing a mask, whether it be from autism or behavior disorders or sensory disorders, because it goes hand in hand with autism. You cannot force these individuals to wear a mask or anything that they don't agree with. You can't force them, as it's traumatizing and it wears on their mental health, which, as everybody knows up here, is very limited. I have a daughter who was born with a severely deviated septum. She cannot breathe out of her left nostril at all. She has a hard time breathing out of her right nostril. She puts anything on her face and it creates anxiety. She hyperventilated and she passed out. She has anxiety. She has sensory disorders. And I'm here to speak on her behalf. And I'm sure she actually got up here, and I was pretty proud of her. My main concern is the healthcare. So these individuals have ongoing healthcare needs. They are not being met right now. They are being denied services because they are not able to wear a mask. Now, ADA, Title III, public accommodations. There should be, for healthcare purposes, some sort of plan in place for those individuals that cannot wear a mask. It's hard going into a store. I'm a single parent. Excuse me, a single parent of 7 children. I don't have the option to not take them with me. They must go with me. Where I go, they go. I was fortunate enough to have respite here with the girls today, as one of my kiddos at their day program was injured and he has a corneal abrasion. I was not able to get that care here in town. I had to drive to Eager to get that done. That's not always an option for those that need that assistance. I think that everybody needs to be included regardless. Inclusion is huge. Just because there's a pandemic, and I get it, I do, you can't force every single person to do something that goes against their health needs. I just ask that you please, if you do mandate it, keep that in mind and to continue helping find a solution if this is ongoing for a longer period of time. Thanks.
Thank you.
Thank you. Anyone else this time? Okay.
My name is Sharon Stone. I'm at 460 North 8th Drive in Sholo. I've heard a lot of talk about people wearing masks, not wearing masks because they have health issues and they can't breathe with them on, or they cannot have them on for mental reasons, whatever. I happen to be a very healthy senior. I fall in a category of somebody who's highly susceptible to COVID. I find that as a healthy person, it's detrimental to my health to wear a mask. When I put one on, it's difficult to breathe. It cuts my oxygen intake, increases my carbon dioxide intake, makes me very lightheaded, and I cannot wear one. I will not wear one. I don't care what the rules are. I will not be wearing a mask. And so I was hoping that as you discuss these things or you educate, that you would also make provision for someone who is healthy and cannot wear a mask or will not wear a mask for health reasons, not because they have health issues, but because they don't want to have health issues. And I thank you for listening.
Thank you.
Thank you.
While you're coming up here, I just want to give one more tidbit about the governor's direction. The age group of 20 to 44 is actually seeing the largest spike of increases of cases right now. So, for what that's worth as far as, it's been changed, but it's also the largest range of 24 years there.
I just want to, I'm Frank Adens, 301 North Retreat Way, and I've listened to your discussion quite a bit. There's some of you that have made comments that, you don't think the city council should do anything. I don't necessarily disagree with that, but I do not believe that you should state that you're not going to do anything. I think that you need to at least reinforce the ideas that the city is supporting the governor and his efforts, and also that you will be assisting businesses to learn what the directives are and educate them. So I think that's the direction that you should go. And so, my
Thank
2
you.
cents.
Appreciate that.
Okay.
Anyone else? This time I'll close.
I'm Christiana Kaufman, and I just wanted to say that I am one of those that cannot wear a mask because honestly, I have really bad breathing issues as it is. And even the doctors, whenever they do blood pressure and stuff, like for like a checkup, they're like, "Can you please breathe for me?" And I'm like, "I am breathing." And then they're confused because I am breathing. It's just not very much. It's shallow. So when I put on mask on, I feel like I can't breathe. I feel like I'm claustrophobic. And it just hurts to know that I could easily die if I, take that precaution to wear a mask. So if you guys could take that into accountability of those that have asthma issues and that can easily get like really sick because they're wearing that mask. Because honestly, those toxins are still, as this gentleman said, that it will go through your hands. Because honestly, how many people have touched this podium today without it being sanitized? Lots of people. So I'm sure those masks are not going to help because I've seen many take it off and then put it back on after they sat down. So I'm just saying that taking into accountability that some of us can't wear masks because it's hard to breathe as it is. And
Thank you. Bring this back to council at this time. I think we've been fair. We've listened to both sides, and now it's time to us to decide or make a decision and go forward. Vice Mayor.
Yes, I definitely agree with what Morgan said. I just don't know what type of language we need to put in there for the governor's thing.
You can correct me, Morgan, or if you'd want to just go ahead and share with him. There's probably
You can tell us what the wording we need to do.
I'm hearing a little bit of covering a little bit of the people that need to have some clarification, protection for them, and Councilmember Clark.
Well, are we looking for a resolution, an ordinance, or a proclamation? Yes,
It would just be probably a proclamation.
Probably just be a proclamation by the mayor, but you could give him some direction what to put in the proclamation. That would be that we follow, the city of Shoal is going to follow the governor's orders, and if we want to put some language in there about those with medical issues or disabilities or exempt from that, we'd probably just have to, not knowing which way the council is going to go, we'd have to take some time to write it up and let the mayor look at it and let everybody.
I'll take a stab at making a motion.
Sure.
I would move that the council authorize the mayor to sign a proclamation that states that we're going to follow the State of Arizona Executive Order 2020-40, and that we're going to, that he would give adequate educational opportunities to the businesses, and that he would direct resources for those educational opportunities, and then also it would specifically address individuals who are physically or medically unable to wear masks, that it would give greater direction, more so than I think that the governor's order does, as far as they would be exempt from wearing masks because of the Americans with Disabilities Act and those protections.
I'll second that.
So we have a motion and we have a second by the Vice Mayor. Is there any other discussion? Councilmember Kelly.
Asking for plain English. For me, this would say if we pass this motion, we're supporting our mayor doing a proclamation with the points that have been made in the motion.
That's correct.
Am I understanding that right? Thanks. I like it.
Any other comments or discussion? Seeing no others, I'll call for the vote. All those in favor? Any opposed? See that pass 7-0. Thank you. Thank you for being with us here today. We appreciate your opportunity. We appreciate this method. I just want to say this is the method that you make decisions and make process. It isn't a popularity of comments in social media. If you want to be heard and you want us to take your actions seriously, thank you for being here, and we appreciate it. Seeing no other business at this time, I'll adjourn this meeting.